Good afternoon, everybody. Thank you so much for remembering that this is today. Happy New Year. Happy New Year. I know it was a while ago. Many of you were in the office for your confirmations. Some of you I did get to see this week for your history visits and try to remind you that we are meeting today. So I imagine there'll be a lot of people watching this on the playback because I usually do it every 2 weeks, but with the holidays, I skipped a week. But thank you all for being here. We're going to go ahead and get started. My host is sharing their screen right now. So if you're able to see it, please raise your electronic hand and let me know. Okay, fantastic. All right, so you can see it. You can't tell who's raising their hand right now. That is because no one can tell that it's you and you're on here right now. We've got a couple of housekeeping items for our practice in pregnancy orientation. First of all, this is confidential. So as I said, no one knows it's you. You can ask me any questions you want and I will be sure to try to answer them without letting anybody know who you are. If I think it's something too personal that people might be able to figure out who you are by it, then I will say, hey, let's defer that to one of your visits, or we'll just talk about it offline. Please participate. So many of you had questions yesterday, and I felt like I was being, really evasive, saying, "Oh, join me on the webinar tomorrow. I'll answer that tomorrow. I'll answer it tomorrow." It's kind of a cliffhanger, but really, I know just about everybody on this call has exactly the same questions. And so I wanted to make sure that I gave everybody the same uniform answer. So please participate. Ask me questions. I hate when it's just me talking. And I have some poll questions hidden throughout here to make sure that you're still involved and paying attention. And afterward, if you have to jump off at any time during this, you'll be able to watch this recorded session on our YouTube channel later on. So we're going to start out with a poll question. Who's on the line? How many first-time mamas do I have, and how many veteran moms do I have? The answering the poll questions also helps me to tailor um, how what I say next because it's a choose your own adventure kind of situation. And so I'll do this with the polls. I'll talk a little bit and then I'll say polls are closing in 3, 2, 1, and you'll vote. And this time it's pretty close, but the first time mamas do outweigh the mommy veterans by just a little bit. All right, so things we are going to go over today. We'll go through the full circle experience, which includes where we deliver. We'll go through our office protocols, including what to expect at your pregnancy visits. I'll give you lots of prenatal resources. We're going to talk about exercise and nutrition in pregnancy, and we'll close with a COVID-19 update. So, first of all, how is Full Circle set up? We are a collaborative midwifery model practice, which labors under the, no pun intended, labors under the premise that pregnancy and birth are normal life processes, not a disease of which we must cure you. The traditional midwifery model takes care of normal, low-risk women, but if you develop some complication with your pregnancy, then you may have to transfer out of traditional midwifery care to a different acuity where you have access to a physician. In the collaborative model, however, you are able to stay under the care with the midwife and have physician consults immediately available for any issues that come up with the pregnancy. To that end, the majority of our vaginal deliveries are performed by our certified nurse midwives. So I know some of you came in as GYN patients of mine or Dr. Merrill's or Dr. Mooney's. You say, all right, well, I'm just going to switch over and be her OB patient, sort of. So you are still under our care. We are still taking care of any complications with your pregnancy, any issues with your pregnancy, anything that's outside of a midwife's scope. But the vaginal deliveries are done by the people who are experts in vaginal deliveries, certified nurse midwives. If there is something that falls outside of the scope of the midwives, they call physician consults. We actually just finished our bi-monthly meeting where we run through the list of everyone who is pregnant, discuss everybody's issues, and make a plan for everyone. If something happens while you're in labor, however, if it's something urgent, like it cannot wait until morning, then the midwives call one of us, Dr. Marrow, Dr. Mooney, myself. I'll live about 15, 20 minutes away from the hospital at the most. We can come in and take care of a baby who just doesn't want to come out. But if it is something emergent, like your baby needs to come out and you don't have 15 minutes, there are OB hospitalists, board certified OB/GYNs who are in-house 24 hours a day for true emergencies. To put that into perspective, we don't have our 2023 numbers quite yet, but 2022, we did over 500 deliveries. Only 2 times in the whole year do we need the OB hospitalist to step in for actual deliveries. And even then, we were there by the time the baby babies were delivering. So emergencies are few and far between, despite what TikTok says. Where do we deliver? That's a great question. We deliver at HCA Florida Hospital, which is on University Boulevard. It's about a 9-minute drive from Full Circle, with traffic. Honestly, it's shorter than that without traffic. They do tours. So you can call, there's a number that the midwives can give you during your prenatal visit. You'll connect with the director of women's services. Stacy's amazing. She comes in on evenings, she comes in on weekends, and does really whatever is convenient to you so that you're able to see where you're going to get to meet your little one or little ones. So be sure and ask us for that resource. HCA also has classes. So there are childbirth education classes while you're there, or when you call that number, you can ask them about when the next session or cycle starts. There's a 5-week course for childbirth education. There's also a breastfeeding course. And then there's sibling classes. So for my veteran mamas, if you've got a little one at home who may not be as excited about welcoming somebody new to the family as you are, this helps to prepare big brothers and big sisters 3 to 7 years or even older for the new baby coming in. How to contact us. So our office is open Monday through Thursday from 9 a.m. to 1 p.m. We close for lunch from 1 to 2, and then we reopen from 2 to 5. So if you happen to call us between 1 and 2, Monday through Thursday, you will get the after hours message. There's a reason for that. The after hours message rolls over to the emergency line. So if you have a true medical emergency, you can still reach the person who's on call between 1 and 2. That voicemail, however, is not for, I think I'm going to be late for my 2 o'clock, or I need to cancel this, or I have some disability paperwork. Please don't leave that message between 1 and 2. Just give us a call back after 2 p.m. and you can reach somebody at the front desk by pressing 0. We're also open on Friday from 9 to 1. So if you're calling and you're leaving a message about something non-emergent on Friday at 12:53 p.m., just know that your message may be answered on Monday when we reopen. We're done with our holiday closures now, so those are pretty predictable and reliable hours. In terms of appointments, we don't do walk-in appointments. Our goal is to see you as close as possible to your appointment time. And if I promised you 3 o'clock and somebody else decides to walk in at 2:55, that is not fair to you because I promised you 3 o'clock. So we don't take walk-in appointments. We do have some same day appointments, some spaces that don't fill, or perhaps someone delivered and now their appointment is free. So if you call at the beginning of the day and we have a same day appointment, you have a matter that you think you need to be seen for earlier than your scheduled appointment, let us know. If there is no same day appointment, we might say, hey, you need to be seen at an urgent care or maybe go over to the hospital to be evaluated. That is not us saying that we don't want to see you. It is us agreeing with you. This is an urgent matter. It should not be sitting in our lobby for 2 or 3 hours waiting to be worked into a schedule. It should be seen urgently. So if you talk to our nurse and she says, yeah, I think you do need to be seen, but we don't have a spot today. Let's see you at the hospital, or let's go to urgent care. Please don't give her a tough time because she's really just trying to get you seen as soon as possible. All right, phone calls. When you are calling, providers are not able to leave appointments to take phone calls. Again, my example, if I promised you my 3 o'clock attention, then I'm going to give you my attention at 3 o'clock. If somebody else decides they want to call and ask a question, that was your time. I promised it to you. So we ask that you have the same respect for our other clients, and we are not able to leave their scheduled appointments to take phone calls. We do have a nurse, Tony, who triages phone calls because, again, usually people have the same sort of things going on with pregnancy. Baby's movements, pains here, a little spotting, those sort of things, urinary tract infections, yeast infections. Tony can handle all those things. If there's something outside of her scope, though, she knows how to get in touch with the emergency on-call person, and she can get an answer and get back to you. But you have to leave a message in order to get a call back. And please leave the message with the right person. So where do I leave the message? Great question. If it is something pregnancy administrative like FMLA paperwork or disability forms, that sort of thing, Tony takes care of those. I also have an OB clinical coordinator. Many of you have already heard from her. Naisha does labs. She does referrals. So many of you received your lab slips after your history visit from my OB coordinator. If at the end of pregnancy you need something scheduled, like a version or your C-section or an induction or even a circumcision, Naisha is the one who does those things as well. If you have some issues with your insurance, Renee Hall, who you all met at your confirmation visit, And many of you, since you came into the office, have switched insurances because it's a new year. If that is the case, please, please, please reach out to Renee so that she can recheck your benefits and make sure that we're no longer collecting on a payment plan that doesn't apply anymore, or that you're not getting a surprise bill at the end because we haven't looked at what your new benefits are. So those are the people and all the same numbers. If it is after hours, there is always somebody on call for our practice from our practice, and that person has access to your information, so we'll know who you are when you call. This is for emergencies. So if you're calling this number, this is think I may need to go to the hospital. Again, you have to leave a voicemail message though, or the phone will not even register that a call came through. So calling and hanging up and calling and hanging up and calling and hanging up, we won't even know that that happened. So please leave us a message if it is an emergency, because we definitely want to be expecting you at the hospital, or at least be able to give the hospital a heads up that you are on your way in. Great. Other ways to contact us. The patient portal. Please remember that the patient portal has a response time of 2 business days. Like literally, as soon as you hit the send button for that message, it says, hey, this will take 2 days for us to respond. So sometimes, you get lucky and you send a message at the same time while we're checking them, and then you get a response within 15 minutes, and you're like, oh my gosh, I can text her anytime and she's going to write me right back. 2 business days. It could be 2 business days. It could be 2 business days. So please be sure that when you're sending a message, it's something that you are prepared to wait for. You may not have to, but just be prepared. There are some examples coming up in the slideshow of what things are okay to wait for. If it is a non-action item, like just want to know about a protein powder or whether or not I can drink this tea. That's not an action item that has to be addressed before your next appointment, so that will likely be passed to the next person who's going to be seeing you. Things for the portal are things like, Jane just ordered some labs for me, but I lost my lab slip, and I just don't want to go to Quest without the lab slip because they might not have the order. That's cool. Give us a portal message. We can re-email or send you the lab slip. Or I have COVID and I need to cancel my appointment, which is more than 2 business days away from now. Definitely send that message out, and we can definitely get you, in touch with the front desk so that we can reschedule the appointment. Things that I do not want to see on the portal. Please don't send me urgent matters. Like, it really freaks me out when it has been 2 business days and I log into the portal and I see someone saying, oh, my blood pressure is through the roof. I haven't felt my baby move. I'm having heavy bleeding. Those are not portal messages. Those are phone calls. That is literally why we have an on-call provider for emergencies. So please don't send those things over the patient portal. It makes me sad. Also, please don't send blitz messages. So if you've sent a message to Lauren, you sent a message to Jane, you send a message to Dawn, cutting and pasting the same messages to multiple people is, one, portal abuse. Two, you may have multiple people working on something for you. It's someone who was very upset one time because she sent messages to 5 people about thinking she had a UTI, and then there were 5 prescriptions, and she was angry because her pharmacy kept calling her. But you have 5 people writing prescriptions for you. So please give the first person 2 business days. If you've not heard from them, we do have some midwives who are part-time here. Like Lauren is only in 2 days. She's on 2 out of the 5 days of the week. So she may not be the person who's going to answer you fastest. There are times that Lauren's here and she is the fastest one. But whoever you choose that you're able to send the message to, give that person some time to respond to it. Also, there have been times that the EMR has thought, our electronic medical record system has thought that it's a bot trying to spam us, sending the same message to 5 people, and deleted the portal account altogether. And it is really hard to get that reinstated, which is very inconvenient when we're trying to send you your labs and your ultrasounds and all of that stuff too. Last thing, please don't try to have an appointment over the portal. If you have questions, usually your questions are more than a yes or no answer. Or if you're saying, hey, I just found out about this vaccine or this medication or something, what are your thoughts on it? That's a visit. That's not a short answer. So you're free to schedule an appointment to come in and talk to us about any of those things. If it's more than a yes or no or an action item for us, then that's something that we can talk about at your visit. You're going to have lots of visits with us before we make this baby. Patient portal also is where you will find results of your ultrasounds. So if there is something abnormal on your ultrasound, Urgently abnormal. We will not let you leave the building without making a plan for what comes next. Otherwise, the reports from the ultrasounds are going to be downloaded from the ultrasound machine, uploaded into our electronic medical record system, divided among the providers for review, and then sent out to you. So it may be 2 business days before you see the report of your ultrasound. Typically, what will happen, Kathleen or Taylor have these little lab slips or slips, sorry, that they'll have you take up to the front desk if you need to schedule a follow-up. If you know that your anxiety will not allow you to wait two days to find out, please schedule an appointment with a provider on the same day following your ultrasound, because then you can get a heads up of what you're going to see on the other when the report comes out. Other than that, though, just know that if we let you walk out of the building, your ultrasound is fine. There's no action item that needs to happen. I will have people sometimes see Kathleen and Taylor typing and go to their car and say, oh my gosh, she was typing a lot of things. What's going on with my baby? And my answer is always, I don't know because I don't have your report yet, but I do know that it was nothing urgently abnormal because she let you walk out of the building. My sonographers have a combined 40+ years of experience and they know what's not supposed to walk out of the building. The other people who have patient portals are Quest. And Quest sometimes sends results to you first without sending them to us. And you see that it has red on it and it freaks you out. Please remember, red doesn't necessarily mean abnormal. The reference ranges that they use, like what's normal on those Quest labs, are for people who are not pregnant. Pregnancy causes some physiologic changes in the body where some numbers may be not normal if you're not pregnant, but they're normal if you are pregnant. So give us a chance to receive the labs from Quest, review them, and release them to the portal for you. You don't need to upload copies of it unless you've had the labs for over a week and you haven't heard anything from us. Just give us some time to get them because we'll send them out with our commentary saying, hey, these all look good. Even the red ones are okay for pregnancy. Any questions on how to contact us, office hours, patient portal use, lab stuff, ultrasounds? All right, cool. Let's move on. What to expect at your visits. 1, expect that you will forget everything that you meant to talk to us about at your visits because you have pregnancy brain. It is real. So please text yourself questions. You can start a text thread with yourself. Things I want to ask Dawn when I come in. Please wear loose, comfortable clothing so that we can access your belly. Winter is usually not too bad. You guys are usually in sweaters or something like that. Dresses are tough because you're pulling the dress all the way up for us to get to the belly. A shirt that you can lift, pants that you can kind of scoot down so that we can get our hands on that belly. We want to listen to the baby's heartbeat at every single visit. We ask that you come in about 5 minutes before your scheduled appointment time, so you'll have time to check in at the front desk, handle any insurance things that are going on there, and if you need to either use the restroom or leave a urine sample. We're not routinely collecting urine samples on everybody. American College of Obstetricians say you no longer have to do that. So you'll know if we need to collect a urine sample, either you just recently had a urinary tract infection and we need to test a cure, or we're checking you for protein or blood sugars. Other than that, we know you're pregnant, you have to go to the bathroom, you've been drinking your water, hopefully, and then by the time you come in, you have to go to the bathroom. So run in, go to the bathroom, that's fine. If you come in early enough, then you'll have time to do all those things and still see us at your appointment time. If you arrive 10 minutes late, we will still be able to see you. We'll check blood pressure, check on baby. It obviously leaves less time for your text message thread and your questions for us. If you arrive 20 minutes late, you have missed the entire appointment time, and out of respect for the next person who has an appointment time, we ask that you allow us to work you in later in the day or reschedule. Front desk is actually really good about that. If they are like there's a car accident and everybody's kind of running a little bit behind, they're good about shifting people back. If you walk in 25 minutes late, they might say, hey, you missed your appointment slot, but there's another one on Lauren's schedule in about 10 minutes. Can you hang out and wait for that? If there's nothing else during that day, then we can just take a look at the schedule for the days coming up and try to find something that is good for both of us. All right, diagnostic ultrasound visits. So the question I get a lot is, when am I going to get another ultrasound? I think somebody asked me this yesterday. And the answer is, I'm going to show you more in depth in a little bit, but diagnostic ultrasound visits are separate from prenatal appointments. So if you have an appointment with one of the midwives, they're not doing ultrasounds. You are not scheduled for an ultrasound. The way to find out, because I know you want to know, well, when do I bring my family? They want to see the baby. Do you have more than one appointment time? And do you have a provider's name associated with your visit? So, for example, if your name were Tina Test, then you would log into your portal because Tina Test is my test patient. And you would click on appointments, and appointments will show you what appointments you have coming up. So Tina has two appointments. She has one at 9:20 with ultrasound. Ultrasound is not a provider's name. Tina is getting, you guessed it, an ultrasound. And then at 10 o'clock, she has an appointment with Dr. Yeckel. Dr. Yeckel is a provider's name. Dr. Yeckel is not going to do an ultrasound. So if Tina only has an appointment with Dr. Yeckel, Tina is not getting an ultrasound that day. If Tina only has an ultrasound appointment, Tina is not seeing one of the providers that day. If you know you're supposed to be doing both, but your portal doesn't say that you're doing both, call us to make sure that you can change that and get both of those things on the schedule for yourself. Remember, the results from the ultrasounds will be sent to your portal within, that's right, 2 business days. So again, if you know that your anxiety won't let you wait, be like Tina, get your 2 appointments on the same day. Unless there is something urgently abnormal, then those findings are going to be discussed the same day. That is the one reason that we will break up our usual schedule, have you sit in a room until someone can come over and talk to you and figure out a plan for what we saw in the ultrasound that day. All right. And again, please let front desk know when you're checking out. Like ideally, when you're checking out from your current visit, you'll schedule both appointments for your next visit. So if you just saw Jane or Lauren and they say, oh, you're going to need an ultrasound coming up. When you check out, be sure you have 2 separate appointments at 2 separate appointment times when those visits are due. All right. If you think I need to look, Jane didn't say I needed an ultrasound, but I think I need one, and you just want to see your baby some more, that's fine. It's your baby. These are places that you can go and do that whenever you feel like it. Boutique ultrasound places. I try to get one like all around the city. There's one in San Jose, one on Kernan, and then one up on Park Street. I know there's one in St. Augustine too, if there are some people farther south there, but these are for informational purposes only. So these are fun ultrasounds. So they can put the baby's heartbeat into a little stuffed animal. They give you tons of 3D pictures. It's just super cute. Just a really good experience. So have fun. Look at your baby whenever you want to. For those of you who are wondering when you'll be able to find out whether it's a boy or girl, I think almost all these places do like gender reveal packages starting around 14 or 15 weeks. So just know that these are the places and that's a thing. All right, here's our next poll question. When should you expect to have routine ultrasounds? And for my veteran mamas who've done this before, you know that the key word here is routine. Are you going to get an ultrasound at every visit, at 20 weeks and 40 weeks? Or do we only do ultrasounds if you have a problem? Polls are open right now. I'm waiting for you to vote, and I'm going to close the polls in 5, 4, 3, 2, 1. Boom. All right. At 20 and 40 weeks is correct. So your anatomy ultrasound, the survey of the baby's heart and kidneys and brain and all that good stuff happens at the 20-week mark. If everything looks normal there and we're able to see everything, that's your only routine ultrasound unless you go past your due date. Things that are non-routine are if we don't see everything we need to see the first time, if baby's growing too big or too small, or if there's some other thing that we need to be following. That's not routine, but you would get extra ultrasounds for those. But routine ultrasounds, 20 weeks, and if you go past your due date. All right, so we're headed over to our website, fullcirclejacks.com, and some of you did have some questions about our relatively new facility. We've been at Memorial now for a little over 2 months. If you missed the town hall that I had in October, you can go to our website and click on the big blue here to watch that town hall. It's about 15, 20 minutes of me talking and just kind of explaining what the move has been. And I have to tell you, the move has been phenomenal. It's been really good for us and for our patients. Everybody is really, really happy. All right, so we're going to start here on the website with the providers. So we read about you and we know about you. Feel free to read a little bit about us before you come in. It was kind of cool. I saw a patient just the other day who said to me, "You have 4 kids, right? And you had a VBAC." And I was like, "Oh my gosh, she read something on the website about me. That was cool." So these are our providers. We have me, we have my partners, Dr. Marrow, Dr. Yeckel, we recently added Dr. Mooney in October as well. We have the midwives, midwife Lauren, midwife Krista, midwife Cindy, midwife Dawn, midwife Missy, and midwife Jane. And one or more of these lucky ladies will get the opportunity to help you meet and welcome your little one or ones into the world. Next thing we're going to take a look at is up at the top where it says patient information. You'll see the obstetrics tab, so go ahead and click on that and you'll know you're in the right place because you'll see all the belly bumps growing until we see the baby there at the end. So it is almost stats time. We're going to have to update our stats for the year. If you follow us on any of the socials, you'll know we are very transparent about our numbers every year. Some years are better than others, but you'll be able to see our delivery stats here on our page back to 2018 with regard to C-section rates, VBAC rates, all that good stuff. Where we're going to start clicking though is the prenatal care timeline. So as we open this up, just know this is the document where you're going to be able to find what to expect at each visit. I do get messages from time to time. What's going to happen the next time I come in? I send them this link. So all of you have had your pregnancy confirmation, which we typically do between 8 and 10 weeks. At that time, you usually meet with Renee Hall. You watch the little video of me saying, welcome to Full Circle, learn about genetic testing. And then you have your history visit with me, which is virtual. And we are also very transparent about what labs we order. There are times I find patients say, oh, I don't know what they really checked on me. You will always know what we're checking on you. So when we do your regular prenatal labs, as I mentioned at your history visit, it's your blood type, your blood count, serologies, urine culture. You have the option at that time to decide whether or not you want to do genetic testing, which tells whether you're a carrier for certain genetic illnesses or whether your baby has Down syndrome or some other chromosomal abnormality. Again, those are optional. You have to be at least 10 weeks to get them done. If you decide to opt out of them, and you want to do them later on, the blood work, you can usually do a bit later. At this point in pregnancy, though, we're seeing you about every 4 weeks. So about 4 weeks after your confirmation visit, you should be coming back into the office for a physical exam. And that's just a regular physical. So we'll listen to your heart and your lungs. A pelvic exam it is involved. If you're due for a pap test, you're welcome to have it done at that time, but it's not required. The pap test is not part of your prenatal panel. Cervical cultures, though, do round out the rest of the ACOG recommended, and so you will need a cervical swab. That can be a self swab. It doesn't have to be an actual physical collection by one of us. And the first question I have is, do you rotate practitioners with appointments so we can meet all possible providers before baby's delivery? That is our preference, is for you to meet everyone because we don't know which one is going to be on call when you go into labor. So we recommend that you meet everyone. Sometimes we have people who say, but I really like Dawn. I only want to see Dawn. If that's what you want to do, just know that's fine. Dawn may not be at your delivery though. So just keep that in the back of your head. Our preference though is no strangers in the delivery room. So we'd like for you to meet all the midwives. All right, so about 4 weeks after you have your physical exam, if you did need to see the high-risk doctors, that would typically be when about the first time that they usually see you is around 12 to 14 weeks. So 4 weeks later, you're coming back into the office for your second trimester belly check. We talk about second trimester things when you start feeling the baby move, get some round ligament pain. And this crew, I think actually we're in the middle of flu season right now, so I just kind of slid this over here on the side. So anytime from October through March, it's fine for you to get your flu vaccine if you haven't already gotten it. About 4 weeks, and we don't do those here in the office. Usually we refer to minute clinics and the like for vaccinations. About 4 weeks later, we're around 20 weeks, and so we know we're going to be doing our anatomy ultrasound. Again, if you need to have an appointment with the midwife on the same day to discuss what was found on your anatomy ultrasound, please make sure that you schedule two appointment times on the same day. We'll usually start our mental health screening at that time, depression and anxiety. Pregnancy is already a very emotional time, and so we want to make sure that we are holistically treating the entire person, not just the uterus throughout the pregnancy, and screening to make sure that we can get ahead of any issues that may complicate intrapartum or postpartum. Midwives will, around this point, start talking about childbirth education classes, breastfeeding classes, making sure you're getting referred over to the right places. I think I have another question here. The next question is about opting out of the glucose tolerance test. That is on an individual basis and typically only for patients who've had bariatric surgery. But typically no. The glucose tolerance test, which is actually the very next thing that's on here, between 24 and 26 weeks is a requirement at Full Circle. We do have some patient-driven options, which I'll talk about in a moment. But the glucose tolerance test is right around 24 to 26 weeks. We usually will repeat a blood count because of iron deficiency that goes with pregnancy around this time. And my moms who are Rh negative for their blood type will know that we're going to start to get their ROGAM together to give between 28 and 30 weeks. My Rh negative moms know what that means. This is when we want to have you pre-register at the hospital. That is an online process, and we have a code that you can scan in the office to do. You can also get your hospital tour going around that time. And if you plan to work with a doula, which I'll talk about in a little bit, you want to have her locked in too. We're moving into our third trimester, and we start seeing you every 2 weeks. So around 30 weeks, which is really actually right around the time that you're doing your glucose test, just one lab draws altogether. You have the option to repeat or decline your standard prenatal labs. So this is from Duval County Health Department, which, as you can imagine, takes care of all sorts of populations with different stratified risks. If you feel that you are low risk for contracting an STD during your pregnancy, we do have a standard form here that says that you can just opt out. And then you can also see over here the third trimester vaccinations. Again, the flu vaccine, if you didn't do it prior, the Tdap, and we'll be adding in here as well the RSV vaccination, and you can discuss with the midwife any questions you have about any of those. For my first-time moms, this is when you want to start looking for who your pediatrician is going to be, because as much as I love taking care of your baby while he or she is in, or they are inside your belly, once they're out, they need to have their own doctor. So you want to find out who's going to be your pediatrician, and what you're really looking for is someone who follows your philosophy in terms of antibiotics, vaccines, that sort of thing. And we continue with the every 2 week appointments. You'll see there on the right, moms who have pregnancy complications like high blood pressures or high blood sugars will do additional testing. And then my moms who are planning a belly birth, which is our term for a cesarean delivery. Usually we start to get your dates on the books right around 33, 34-ish weeks. You'll continue with the every 2 week visits until 36 weeks when we do one more pelvic exam for group beta strep, and we'll talk to you then about why that's important. And if you've already opted out of repeating the STD panel, that includes repeating the cervical cultures at 36 weeks. This is when we start seeing you weekly. This is the fun time. So most of our hard work is done, and we're just waiting for baby at this point. So if you want to bring in your birth plan, which we're going to talk about in a little bit, and because now you'll be full term, so birth plans are on the table fully. Start your natural cervical ripening methods. For my moms with the belly birth, you're going to get off the train around 39 weeks traditionally. And for my moms who are waiting for baby to give the signal, you're going to be patient, because sometimes babies just take their time giving that little signal. We want everyone delivered by 42 weeks. So first time moms, we would typically like for you to schedule your induction around 41 weeks and 5 days. For my veteran moms, your labors are usually a bit shorter, and so 41 weeks and 6 days, again, so that everyone can be delivered by 42 weeks. And as we go back to the presentation, I'm going to answer the next. Can we opt out of induction? You mean at all, ever? You can definitely sign an against medical advice form, because we do not recommend going past 42 weeks. Because your risk of stillborn goes up significantly at 42 weeks. All right. Next, I think I have a portal. No, yes, I have a question. If you have a headache during pregnancy, are you more likely to meditate? Are you more likely to medicate, like take a Tylenol, which is fine, by the way, or to evacuate your house and go to the emergency room? This is a poll question. So I'm going to close the polls in 5, 4, 3, 2, 1. Polls are closed. We have more meditators than medicators today. Unfortunately, no evacuators. So some of you have already heard, oh, I've had these headaches this whole time, and I know I can't take anything because I'm pregnant. Well, that's just not true. Here is our list of pregnancy safe medications. So not all of them are are medicines. Some of them are relief measures. We'll start with headache because that's really just so common. Hormonal headaches, especially in the beginning of pregnancy, are pretty miserable. Typically, the first thing that we will tell you to do, besides drinking lots of water, trying to get enough rest, is magnesium. So taking magnesium once or twice daily, having something that's caffeinated, green tea, black tea, either of those things are fine too. So there are some things on here that are more Eastern medicine, some things that are more Western medicine. So I think another one like heartburn or indigestion is another good one. So papaya enzymes is usually the first go-to, I say. And then if you're not able to get it under control with those, then we do have some over-the-counter things that are okay, as well as some things that we want you to avoid. So no Pepto-Bismol and Mucinex you'll see on here because cough and cold season, there is something miserable going on around right now. Every phone call we got over the weekend was, I'm congested with a fever. I'm congested with a fever. And so on here, you'll see things about cough and cold as well, sore throat. And if you've exhausted everything on this list, and you're still having the problem, then please reach out to one of us because it may be time for something prescription. But the first thing I'm going to ask if you reach out about anything on this list is, have you tried everything on this list? And I'll send you this link. All right, so just please remember that this is out here. You can download it to your phone. You can print it out and put it on your refrigerator if you're old school like me, because I promise every time you need this, it's going to be like 3 in the morning. All right, gestational diabetes screening test. We're not going to click on this one right now, but I'm going to refer back to it later on because I do have a full conversation about gestational diabetes coming up in a moment. Weight gain in pregnancy is another conversation that I've been having recently with you all at your history visits. Some of you are freaked out that you haven't gained enough weight yet. It's only first trimester. So as you can see over here, the rates of weight gain in your third column here are in your second and third trimester. First trimester, everyone's sick. No one has an appetite. Everyone's sleepy. You don't really gain very much weight. That's okay. To know how much weight you should be gaining overall, it really depends on where you started. So it goes by your body mass index. There's a link on here you can click and put in your height and weight, and that tells you where you're starting in terms of your body mass index. Based on that, it tells you how much you should be gaining. If you have twins, you can add 10 pounds to the upper number on there. Good for you. And you can just see that these are the numbers that you want to be striving for in your second and third trimester per week. And we'll talk a little bit more about the nutrition involved in getting to these numbers when we go back to the presentation. All right, our next box here is about birth preferences. Yes, let's definitely take a look at that. So this is where you're going to get your birth plan. So Full Circle will be 10 years old this year. In the beginning, we used to get a lot of birth plans, and then people kind of figured out who we were, and they realized, well, okay, you guys already kind of know what everybody wants. But sometimes if you have anxiety, especially for my first time moms, it really helps to be able to write things down and talk them out and have a clear plan for what you're looking for. And I would also advise having clear reasons behind your clear plan, because you can definitely listen to one person say, never take Pitocin. But if you don't really know why or how it's actually used, then you may say no to it at a point where it's actually really important. Like Pitocin actually keeps people from hemorrhaging sometimes. So there are lots of different things on here, induction scenarios, everything from how you would like for labor to begin, or what you want to wear in labor, how you want to be monitored, pain control, relaxation. One of the important things I like to emphasize here is that we're not talking about strapping you to the bed and starving you, because labor is an active process. It is an exhausting process. And so we want you to be well hydrated. We want you to have enough glucose to get through it. We want you to get into positions that help baby to be an active participant in labor as well. So yes, walking around is fine. As we scroll down to the next page, you'll see pushing and delivering in different positions is fine too. Our standard is usually delayed cord clamping and immediate skin to skin, but if there are other considerations, like if you're doing cord blood banking for stem cell, then delayed cord clamping is not, until the cord finishes pulsating, obviously you won't be able to collect any. So we want to talk about these things ahead of time to set expectations so that we know that we can get the most of what you want from all the lists on here. Hang on, there's another question here. Had my first two in the water. I heard I can't deliver in the water at Memorial. Can I sign something to still do it, or is it out of the question? We don't do water deliveries inside the hospital. You may want to look at some of the birth centers in town who do offer in water births, though, if that's something that you're looking for. But we do have the tubs for labor. Hydrotherapy was one of the things that was on there, as well as nitrous, which is coming soon. It's been coming soon for a minute, but I promise it really is coming soon now. Um, Not everything on here applies to everyone on here, so it may seem a little daunting. There are 21 boxes here. You can take one box per week, and like I said, they're not all about like most of you are not having twins. So these don't all apply, but just take one box a week and very slowly, dissect it and figure out what things are actually right for you. And like I said, you can always bring this in and talk to the midwives to get a medical perspective on what you're looking for too. All right. So just know that this is out here. That last one about belly births to gentle cesareans are a thing here at Full Circle too. And if you're on any of our socials, you'll see we have just some information about what the elements are of a gentle cesarean, because there are some moms who are, for whatever reason, unable to deliver vaginally or decline to have a trial of labor after a previous cesarean. For those who are planning to labor, cervical ripening techniques is going to be something that you're going to want to look at. So we'll click on that because there are things that you can do as early as 20 weeks to help tone the uterus. You can take your raspberry leaf tea. There are also some things that start at 36 weeks, and you guys can read through these, your acupuncture and your evening primrose and dates and clary sage and all of that good stuff. So week by week, there are things that we do add on here. You will notice one thing that is not on there is castor oil, and there is a very specific reason that it's not on there. And I will tell you if you have an appointment with me. Probably the midwives will tell you too why that's not on our list. All right, first time moms, listen up. Also, do I have anyone on here who's had a previous C-section and is looking for a VBAC? This won't apply to more than half the people on here, but so VBAC is vaginal birth after cesarean. And closing the polls in 3, 2. Okay, yay, we have one. All right, very good. All right, so this is our list for initially it just said trial of labor after cesarean, but I added in first time moms because really both groups of people are trying to do the same thing. You're trying to avoid an unnecessary C-section. And so are we. So we can't control what the babies do, and veteran mamas know that even after they're out, you can't control what they do. But we invite you to control what you can. These are our tried and true ways that we maintain VBAC success rates of greater than 80% nearly every year. So Webster, Pilates, yoga, method specific childbirth squats, all these things. Again, you guys can definitely read, but I think most importantly there at the bottom is trust your body and your providers, because if we're recommending something for you, it's because we like our numbers and we want you to be successful. And we do a lot of VBACs and we do a lot of vaginal deliveries, and we have a low labor to cesarean rate. And so our goal is the same as yours, is for you to safely have the delivery that you're looking for. So trust us. Let us help you. We want to help you. All right, we'll go back. And I think the next box that we're going to see there is about your little guy. If you're having a little guy and you want to have him circumcised, we don't do those in the hospital. We do them in the office before he is 10 days old. So you'll just let us know after you deliver if this is what you want. We'll have Naisha reach out to you with his little appointment time. Okay, so remember all of this stuff is at fullcirclejacks.com, and it is available all day, every day for you to take a look at any of it. So my very favorite patients bring in their prenatal care timelines all marked up with highlighters and stars, and I just love that. All right, so now we're going to get into nutrition, and first thing we're going to do is attack Dr. Adams for liking salted caramel mocha drinks. So as you can see, those who are concerned that maybe too little weight gain is not their problem. I don't know what I'm doing, Dr. Adams. All I'm having is a cup of coffee in the morning. Are you? Or are you having one of these salted caramel mocha monstrosities? Oh my goodness, the sugar. Did you know that pregnancy only requires an additional 300 calories per day? That's not a lot. It takes 10 kilocalories to maintain a pound. And the amount of weight that you should gain in pregnancy, as we mentioned, is based on what your starting body mass index is. So, if you are starting this pregnancy at 170 pounds, it takes you 1,700 calories to maintain that for the day. If your goal weight gain, which you should be getting in your second and third trimester, is 250 calories. That's for 25 pounds. That gives you a total of 1950 for your calories. Divide that between breakfast, lunch, and dinner, and that's 650 per meal. Be careful not to drink your calories, because if you eat your 650 calories and then you wash them down with 570 calories in your milk of monstrosity, your body does not know the difference. Your baby gets that 300 calories and you get to keep the rest. Happy Mother's Day. So what things should we be looking at when we turn over our food? We definitely want to make sure that you are getting enough protein. We're going to talk about the right amounts of protein and not too much sodium. We'll talk about that in a moment as well. So these nutrition facts are on the back of everything, and just tiny changes. Like, we're not like, this is evolution, not revolution. I'm not saying give up spaghetti sauce, but you can see you can make some smart choices about your spaghetti sauce to get much less sodium. Because when those rings stop fitting in the second and third trimester, the first question I'm going to ask you is, how much salt did you eat yesterday? All right. So you can have fruits, you can have veggies, whole grains, cereal. You're not going to give your baby a nut or dairy allergy by eating those things in pregnancy. So carry on. For my coffee drinkers, you want to keep it at less than 200 milligrams of caffeine daily. Do remember, though, that caffeine is a diuretic. So you want to use the 3-to-1 rule. However much caffeine you're taking in, you want to take in 3 times as much water so that you are staying hydrated. Also, toward the end of pregnancy, if we have some issues with baby's heart rate going too fast, then we may have to cut out caffeine altogether. Usually, I tell people, if we're putting an upper limit on it, try to stay well below it, or be off of it if you possibly can. Herbal teas are fine, and these are some of our faves in pregnancy: raspberry leaf, ginger, lemon, peppermint. For protein, your sweet spot is going to be around 70 grams a day. I know there are lots of pregnancy diets out there that tell you to cram in 120 grams of protein. One, that's just really difficult to do. And two, it's not necessary anymore. That's a diet when people were living a lot differently. And you will grow a 10-pound baby if you take in 120 grams of protein daily. 70 grams is your sweet spot. You don't want to take in too little either. You get these scrawny little undercooked babies. And I like a very decent sized baby, and 70 grams is going to get you there to pretty much across the board. Other things that you can have: deli meat. Yes, you can. Just be sure you microwave it for 30 seconds. It does not have to be piping hot and steaming out of the microwave. Don't burn your mouth. But you want to make sure you're killing any bacteria in your deli meats. Your soft cheeses, as long as they're made with pasteurized milk, they're okay. So if you're getting them from Trader Joe's or Publix, just flip them over and you'll be fine. If it is something you're getting at a restaurant and you can't verify it's made with pasteurized milk, like it probably is, because most restaurants aren't taking that chance. But if you can't verify it, then you skip the soft cheese for the night. You can have canned tuna, up to 3 4-ounce cans per week as well, which I think is plenty of tuna. But if you're a pescatarian and you say, I need more fish, Dr. A, here you go. The FDA has a nice document on what kinds of fish you should eat. This goes over really nicely just what you should stay away from, because of high methyl mercuries, things you should eat sparingly, and things you should eat a lot of because they're high in DHA, which is with omega-3s, which are good for baby's brain development. It's like a 2-page document. I'm not going to put the whole thing on there, but just know that this is available on our YouTube channel, and you can look at it later on. Things you want to stay away from: undercooked meats and fish. So if you are a foodie and you enjoy your medium steaks like I do, you will need to ruin your steaks for the next several months and make them well done. Sorry, no more of that yummy ahi tuna until this baby is out either. For my kombucha drinkers, my kimchi eaters, those are fermented beverage and foods. If you've already had a little bit in pregnancy, you're going to be okay. But we don't recommend those in high volumes, because fermented things your body treats as alcohol, and we don't recommend alcohol in pregnancy either. Your sodium, you want to keep under 1,500 milligrams per day. Again, start turning your food over. You will be appalled at how much sodium is in your food. 1,500 milligrams is going to be your total for the whole day to keep your swelling at an optimal level. All right, any questions about food before we move into exercise? All right, cool. All right, exercise. It is just fine for you to continue whatever your pre-pregnancy activity was, unless your pre-pregnancy activity was doing nothing. You just won't feel like it right now. You're tired, you're nauseous. In the second trimester, when you start feeling better, you also increase your blood volume by 50%, your oxygen saturations and tensions go up, and that will accommodate more aerobic activity. So just listen to your body. If you're not doing your triathlon like you were before pregnancy, don't beat yourself up. It will come back. As we flip to the next screen, I am asking, do you have sample meal plans or top foods to eat? Actually, we do have some sample meal plans. They are kind of along the lines of gestational diabetes, but it's still a good guideline because they do 2,200 and 2,000 calorie meals, assuming that you're going to be burning off a certain amount of it. And they have really good protein intake and breakdown. If when you come in for your visit, Dr. Miro and the midwives I know have those available, so definitely ask for them. If you haven't been doing anything prior to your pregnancy, it is okay to start a new regimen because the most common reason that I do C-sections is not big baby, it's not baby in distress, it is malpositioned baby. So it is sunny side up baby and it is crooked head baby. And moms who are in a sedentary lifestyle ever since COVID, when everyone has been working from home or working at home, kind of sitting slumped down in their chair like that, that encourages babies to descend into the pelvis sunny side up. That leads to malpositioned babies, which leads to us really, really trying our hardest in labor to flip them around. Sometimes we're successful, sometimes we're not. Um, so we encourage exercises that get baby in the right position and good posture and not being sedentary. For those of you with these cute little Fitbit watches that you're obsessively monitoring what your heart rate is and probably adding to your anxiety by obsessively monitoring it, if you notice that your resting heart rate has gone up by 10 to 20 beats per minute, that is normal in pregnancy. That is physiologic. That is okay. If you're not getting dizzy and the room's not blacking out, you're not passing out, that is okay. That's what your body is supposed to be doing. The next question I have here is what if you crave certain things like salt? Does this mean you may need more salt in your diet or is it just a pregnancy craving? First thing we always check is whether or not your iron levels are okay. If your iron levels are all right, then yes, it may just be a pregnancy craving. And if so, it's still like you can still keep within your limit because 1,500, it's not terribly restrictive if you space it out in terms of your sodium for the day. Um, for those of you who say that you have been exercising because you walk a lot, and I said, we'll talk about that. We're going to talk about that now. So, walking is sometimes exercise, but it's only considered exercise if your heart rate is in the aerobic zone, which is 70% of your max heart rate. Other question I get is, how high should my heart rate get? Your max heart rate is 220 minus your age. So, if you're 30 years old, you start with 220, you subtract 30. You should not be exercising for extended periods of time with a heart rate over 190. Your aerobic zone, however, starts at 70% of that, so 133. So if you are walking and your heart rate is between 133 and 190 for 30 minutes, 3 times a week, that is exercise. If you're walking from your car to the office or your desk to the refrigerator and your heart rate does not hit 133, that is transportation and it is not exercise and it does not count. So try to get some exercise in, not just transportation. What type of exercises, Dr. A? Great question. Cardio. You like treadmill? Go for it. Elliptical? Yes. Running? Absolutely. Swimming? Find a heated pool. Indoor bike? Sure. Peloton. If you have a Peloton, my leaderboard name is Off My Meds 8, and I've been just awful over the holidays. So please follow me. I will follow back, and I will exercise more if I know that you're watching me. Other exercises that we like for you to do, weightlifting. If you were already lifting prior to pregnancy, you can lift your pre-pregnancy level. You don't need to increase your resistance because your baby and your body are going to be doing that during pregnancy. Squats are my favorite. Build up to 50 squats per day. That helps to get that pelvis open, get that baby to descend in the right position. I love squats. If you're not an experienced squatter, at 20 weeks, I want you to start by giving me 5 per day. 21 weeks, give me 10 a day. 22 weeks, give me 15 a day. You're building up to 50. If you can do more than 50, go for it. But you can give me 25 in the morning, 25 before you get back in the bed. That will help us with labor tremendously. Yoga and Pilates are also 2 of my absolute favorites because, again, think long, lean, stretching exercises. Any experienced instructor will be able to tell you what the pregnancy modifications are for those as well. Exercises that you want to avoid, though. High intensity interval after first trimester. It's not the interval, it's the intensity. You can do the low impact versions of most of these things, but it's those sudden jerking movements. We don't want to shear the placenta at all. Lying flat on your back for extended periods of time, like excessive ab work. You can do standing abs, you can do side lying abs. Ab work is fine. It's just the lying flat on your back and doing things that require additional oxygen. Hot yoga, unless you are a hot yoga instructor and fully acclimated to that environment, you can hold off because you'll probably get dizzy with your increased requirements for oxygen too. Speaking of needing more oxygen, you also want to avoid scuba because barometric pressure changes are bad for baby, and high altitude hiking. You can visit your family at high altitudes, but just don't go hiking with them because you'll probably get dizzy and pass out and ruin everybody's trip. Contact sports, please don't take up kickboxing during this time either. And outdoor biking, one, it's really cold out right now, but after 16 weeks, your center of gravity shifts. And a lot of times when you try to turn corners, you just kind of fall over. So if you're going to do it, there's an asterisk on it. Just be mindful of being careful going around those corners. So I promised you to talk about gestational diabetes. Now that we have discussed nutrition and exercise, can you prevent gestational diabetes with diet and exercise? If you follow all the rules, do the right calories, and you do all your exercise and your squats, can you prevent yourself from getting gestational diabetes? My veteran mamas know. Polls are closing in 3, 2, 1. The answer is no. You can't prevent it. And I'm going to tell you why. And this is why we don't do opting out of gestational diabetes screening. So your number one risk factor for having gestational diabetes is a placenta. Yeah. So the placenta gives off hormones that decrease the ability of your insulin to do its job. Insulin has one job. Insulin is supposed to clear your body of glucose. Outside of pregnancy, most people, their insulin does its job, clears the body of glucose, and we're fine. During pregnancy, your placenta gives off these hormones that tell your insulin, you should call out today. You don't need to go to work. So now your insulin is not doing its job and your glucose is circulating in excess amounts. And that is what diabetes is. That's why it's called gestational diabetes, because it's essentially extra glucose because you have a placenta. Now, if you can figure out how to do this pregnancy without a placenta, then I don't need to screen you for gestational diabetes, but pretty sure everybody on this call has a placenta. So for my ladies who say, but I never have any types of sugar, you do eat good sugars, you eat good carbs. So I advise not avoiding carbohydrates prior to the test. So do your fruits, do your whole grains, and those sort of things. The next question, the question I have out here is how will bariatric moms know? So that one you run through Dr. Marrow. Dr. Marrow she manages our in-house gestational diabetics and our bariatric patients. So that we don't usually go into depth with that. I let her manage those patients on a case by case. So be sure that you're having your good carbs, as I was mentioning, prior to the test. There are some patient-driven options that are out there. We have at our office the Simply Pure drink, which is soy-free, it is dye-free, it is gluten-free, it is BVO-free, it is kosher, it is vegan, it is offensive to almost no one. That's for sale here at Full Circle. If you're going to be using one of our options, though, please let us know because Quest does not allow outside drinks. And we need to write it on your lab slip for you to go to LabCorp BioReference that you're bringing in something and go over the rules like don't drink it before you get to the place, don't drink anything else with it, and that sort of thing. There are other patient-driven options available on our website, which include the Fresh Test, Glucorganics, and glucose tablets, which you can get off of Amazon. Next question I have is, can we use alternatives like the Fresh Test? Just said that. Yes, you can. Or diabetic blood sugar finger prick testing. No, that is not an alternative. But the other alternatives are out there on our website. So yes. See, I knew you were going to ask that question. All right. So just remember that information is on our website, though, for what the alternatives are. All right, preparing for birth, childbirth education classes. So right around 20 weeks when the midwives start to talk to you about what you're looking for in a birth experience, if you're looking for a method class, Again, these are just informational purposes only, but the ones that are listed here are in no particular order. There's hypnobirthing, hypnobabies, there's Lamaze, there's Bradley method. So all of those are out there. And depending on what you're looking for, we can try to match you up to what class makes the most sense for you. And there are lots more out there beyond this as well. Next slide. Also, breastfeeding classes. So I did mention that HCA has classes too. La Leche League also has classes, and several of the doulas who are in town are certified lactation consultants. So if you need a more personal experience rather than a group experience, we can also try to help you get that together too. CPR for parents. Every new parent should know CPR. And if you already know adult CPR, it's not just doing it really lightly and just with your thumbs. There are different intervals and things that everyone should. And it's also just good to have a good refresher, even if you already know it. So Red Cross, of course, there's a link here. And then there's Jack's Mobile CPR. They'll actually come to you and do a CPR class at your house, which is kind of cool. If you're already seeing a chiropractor, fantastic. They are one of our best safeguards against malposition babies. So first-time mamas and VBAC mamas, listen up. If you're seeing a chiropractor already, you want to make sure he or she is Webster certified, which is a special pregnancy certification that accounts for the different changes in your body during pregnancy so that your adjustments are safe and effective. All right. I think my next question is about doulas, is it? How many people are planning to work with a doula? I have a poll question out there. All right. If you're not sure and you don't know what a doula is, fear not. That's gonna be actually my next topic is what doulas are here for. All right, polls are closing in 3, 2, 1. I had extra person vote today, this time. Okay, fantastic. Oh, most of you are working with doulas. That makes my heart happy. All right, so next slide. Preparing for birth. So doulas are there for physical and emotional support. They are a part of your birth team because pregnancy is emotional and it is physical. And then it's kind of a dichotomy because there is also a medical component for it. For the medical component, you're certified nurse midwife. These are nurses, they're registered nurses who then went on to get their advanced practice. So they're ARNP, APRN now is what we're called. And then they did an additional master's in midwifery. So they're part of your medical team. So if you have questions about, should I use this medication? Should I do that? Those are things for your midwife. If you have questions about labor positions, comfort, other things, natural things that you can do to get labor going, then those are things for your doula. And that's how your team all works together. Because people say, well, why do I need a doula and a midwife and a doctor and a nurse? You have a whole team helping you. The best doulas with whom we have worked, and we've worked with doulas ever since we have opened. Doulas love sending us their patients because they know they can focus on supporting their clients and not arguing with us about doing things that are likely just for our convenience. They know we all have the same goals. The best doulas that we worked with come to your house when labor starts, and they do not leave your side until that baby is out and latched. So if you have questions about, your doula's contracts and what services that they provide, like, is this right? Talk to the midwives. They have no shortage of opinions on who the best doulas are in town, with whom we've worked in terms of supporting our patients. Acupuncture definitely recommended for maternal comfort. If you have sciatic pain, back pain, also for baby positioning and pregnancy massage. Most places won't do massages in first trimester, and some of them will require a note for second trimester. If you need that, we do have a standard pregnancy massage note that we can get to as well. Just let us know at your visit and we can get that for you. Next. We also have breast pumps. Many of your insurances cover breast pumps. We have a QR code in the exam rooms. Please just come in and scan our code because the company that we're using, it's really easy. They check your insurance, they send you a list of pumps, you pick it, they get it mailed to you. Super simple. There are a lot of companies out there that can do it. It's not as easy. And a lot of times we don't get the messages. You're messaging us. They ask for a bunch of information that's not relevant. This company that we found, it is very, very easy. You scan the code and I promise you have your breast pump within a month. So around 20 weeks, when you're getting your anatomy ultrasound, this is when you want to look for your breast pump information. We can get that process started so that the pump is here in plenty of time before baby is here. All right. Next, postpartum, because at some point this is going to end. For those who have any issues with blood pressure during pregnancy, you'll be back in the office in 1 to 2 weeks for blood pressure check. For my belly birth mamas, 1 to 2 weeks as well for your incision check. And again, routine mental health screening. Baby blues are quite common. 80% of women may have baby blues, but postpartum depression and postpartum anxiety is when it extends beyond the first 10 to 14 days. And we want to really be on top of catching that. So mental health checks we do schedule for certain at-risk patients at the 1 to 2 week mark. Postpartum doulas, because again, doulas are there for emotional and physical support. And when do you need more of that than when you're bringing home a baby? You're emotional and you're physically drained. The motherhood space is a new resource in Jacksonville about which I'm so excited. We're one of 5 cities in the country that has access to a grant. Dr. Jill Garrett, a renowned psychologist who specializes in postpartum care, has set up this amazing program at the Winston YMCA. It's 3 hours with free childcare. 5 days a week that moms can just go and talk and walk and do yoga and all these things. And so if you're, it's covered by insurance. If you're an acceptable candidate, we are more than happy to get you onto that track. And then pelvic floor therapy. This is something that is standard of care in Europe. In America, we're just behind a little bit with this, but we're doing our best to catch up. Babies change things. Pelvic floor therapy helps you with that sensation of heaviness, with leaking urine, with gas, and all of the things that happen after a whole human passes through that pelvis. We have a nurse who comes in here. If you're in network with me, you're in network with her. And she is here 3 days a week. And so typically, when you're about 8 weeks postpartum, is when we begin an 8 week session of pelvic floor therapy rehab. Gets you feeling so much better. I only did it after my third one. I totally wish I'd done it after my first and second. So that is routine. Expect for that to happen after your 6 week postpartum visit as well. Random frequently asked questions. We're almost at the end here. Yes, you can sleep on your left, your right, or your back. If sleeping on your back freaks you out or makes you dizzy, you can get one of those wedge pillows off of Amazon and slide it under your hip. Yes, you can help paint the nursery. Just be sure you're in a well-ventilated room and or wearing a mask. You can take probiotics during pregnancy as well. You can also dye your hair, which includes dyeing your eyebrows. You can wear gel nails if you're going to the salon. You may also want to wear a mask because the fumes can be kind of heavy sometimes. Car travel, you can travel up to 37 weeks because at full term, we want you to be close to us in case you go into labor and try to avoid those long trips away. Just be sure you're getting out and stretching every 2 hours. Travel by flight for my twin moms is okay until 32 weeks. For my singleton moms is okay up until 36 weeks. Compression hose, those tight compression hose, you want to wear those and drink lots of water, get up, go to the bathroom frequently, and do toe raises in the seats to prevent yourself from getting blood clots in your legs that can travel to your lungs. For skincare, you can use your salicylic acid, your benzoyl peroxide, just nothing that has retinol in it. And if you're looking for a retinol alternative, there is Bakuchiol, Bakuchiol, which is in many natural products. That is a good alternative that is pregnancy safe and not a retinol. Things to stay away from, because I think we're into my June, July, and August crowd. So no water slides and no roller coasters. This list is always very short. All right, last thing we have, I believe, is our COVID-19 update, and then we're out of here. Thank you for your patience and time. So ACOG moved away from supporting either way moms with regard to vaccinations to strongly recommending it based on studying 35,000 vaccinated women in 2021. Moderna and Pfizer vaccines are okay. We don't recommend Johnson & Johnson because of its independent risk of blood clots. I'm going to come back to that question in just a moment. In terms of boosters, they're all approved for boosters. If you're 6 months past your last Moderna or Pfizer, you can get another one. If you're 2 months past your Johnson & Johnson, you can get a Moderna or Pfizer because mixing and matching is okay. There's no optimal time versus your Tdap, your flu, or your RSV vaccines because they do work differently. If you do contract COVID, there are no formal recommendations for ivermectin or azithromycin or Plaquenil, so we're not prescribing those. What we do recommend are zinc, vitamin C, and vitamin D in the doses that are listed on here. We also recommend starting a baby aspirin about 81 milligrams to continue until you're 36 weeks. If you get COVID after 36 weeks, don't start the baby aspirin because you'll increase your risk for bleeding at delivery. After the time that you contract it, there is an increased risk for gestational hypertension due to previous COVID in a pregnancy. So we do check to make sure that we're still growing appropriately. Baby's growth is not restricted with serial growth ultrasounds. Your recommended course of action is just supportive at home as if you have a cold. You'll see our website has stuff about sore throat and congestion and all of that. You only need to go to the hospital if you're having difficulty breathing or you're unable to break your fever that's higher than 101. Finally, the visitation, because I think I'm still having some of my moms now had their first babies during COVID, and I know y'all a little shell shocked. We're up to four visitors. We're back to our normal, plus your certified doula. We're not requiring masks in the hospital or in the room or in labor unless you are actually actively COVID positive at the time of delivery. Even if you do test positive for COVID during labor or delivery, we're not separating you from your baby. We're still encouraging breastfeeding. You'll be given an N95 mask and an isolate to keep baby from exposure to the respiratory droplets. The question that I did have down here are hot tubs okay? Just want to keep the temperatures below 102. All right, last question, last poll of the day. What things can you find on the website? Can you find your birth plan template, your safe medications, what to expect at each visit, or are you a STAR test taker and you read all the way through and realize the right answer is all of the above? Yes, you are. 5, 4, 3, 2, 1. Polls are closed. Any other questions for anything that I did not answer today? Because I do feel like I answered just about everything that everyone was asking me during their history visits. And since nobody asked me any more questions, I'm just going to guess that that's what happened. So we are social. Please follow us on all the social things. The question pops up and it says something about a new advisory on mRNA vaccines and their administration from Florida's Surgeon General. Florida Surgeon General, no. We are on the Book of Faces. We are on the X formerly known as Twitter. We are on the Gram of Instas, and we are on YouTube. So all of those things are out there. And our stats will be coming out. So those of you who came to our practice because you're looking for a VBAC and you want to know whether or not 2023 was a good year, I'm looking for it as well too. I think it was. I'm excited. So thank you guys for your time and your patience today. Thank you for remembering me. It's been like 3 weeks since you came in for your confirmation and you still showed up. Remember, this is going to be on our YouTube channel later on. I appreciate you all so much for being part of the Full Circle family, and we will see you guys very soon. Bye.